Well, if you know anyone who has gotten a hip replacement, you know how long the healing process can be. But what if there was something that could change all of that? We welcome Dr. Robert Shortino to the show this morning. Good morning to you.
Good morning. Thanks for having me.
Unbelievable. I mean, everybody who has either had a hip replacement or perhaps needs one should turn and give their full attention to the TV right now as you talk about SuperPath. What is this technique?
SuperPath is a new technique for hip replacement surgery. The actual implant that we use is the same type of hip replacement that I've been doing for 20 years, but the technique is what's different. Most people don't know this, but whenever anyone has a hip replacement, the first thing the surgeon has to do is dislocate their hip, meaning they have to pop the hip out of the socket, they work on it, and then put it back together, okay? Now with the SuperPath technique, we never actually have to dislocate the hip. And because we don't have to dislocate the hip, we don't have to cut all the ligaments that you would normally have to do to dislocate the hip. So there's less bleeding during surgery, there's less pain after surgery. People get up a lot faster, and they don't have to follow all the same, what we call hip precautions that other patients have to do, meaning most patients with a hip replacement, they can't cross their legs, they can't flex past 90 degrees, and they have to have a big blue foam pillow between their legs for 6 weeks.
So they're basically doing everything that they were before.
Oh yeah.
And in a much faster time frame. I mean, this is so minimally invasive that oftentimes either that same day or the next day your patients are headed home.
Absolutely. About half of my patients go home the day after surgery. And I've even had a patient go home the day of surgery. We did surgery in the morning and went home that same day. And
who qualifies for this? Is there a certain candidate? Is there a certain patient that should be getting SuperPath?
Well, basically it's any patient who has severe arthritis of the hip, who has, we talk about bone-on-bone arthritis, where it's just there's no other good option. Certainly, if your pain is controllable by medications or injections or therapy or other things like that, but once someone has had all that and nothing's helping their pain and their life is really limited, then that's the candidate for hip replacement surgery.
And you brought some tools with you to briefly explain to us this procedure.
Yeah, I have a typical hip replacement. This is the type and the brand that I use. It's composed of basically two parts. There's the socket, which is this part right here. We call that the acetabular component. And then there's the femoral component, which is this right here. And basically this goes in the thigh bone and this goes in the socket, and the two fit together just like this. And you'll notice they aren't actually attached together. They can kind of move around like this, just like the hip is a universal joint. But what holds them together is all the ligaments that are of the hip joint, which we leave intact with the SuperPath technique, and with other techniques aren't left intact. So that's why I think this is a much better technique and a much faster recovery for my patients.
And you have done a number of these, and you're one of the only doctors to be performing this right now.
That's right. I've been doing it for about 2 years now. I've done over 100 cases. My results have been great. In some ways, I'm surprised that more people haven't caught on to this, because it really is. I really have noticed my patients getting better a lot faster. And my patients do extremely well.
Yeah, faster time recovery.
Absolutely.
And back into their routine in no time. Doctor, thank you for being with us this morning.
Well, thanks for having me. I really want to get the word out. This is a good thing for people.
Certainly. We know a lot of people will be having questions. Get in touch with you. So here is a number that you call. If you'd like to hear more about the new SuperPath technology, just call Jones and Shortino Orthopedics at this number, 314-434-3240, or you can visit their website, stlortho.com.